Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today I'm talking about why your thyroid labs don't tell the full story of what's going on with your physiology. So maybe you've been told, hey, your labs are normal, therefore you don't have a thyroid condition, and yet you're sitting there overweight, puffy, constipated, hair's thinning, eyebrows are gone, no libido, constipated. And you're saying, listen, you may say my labs are normal, but I don't feel normal. Maybe you've been to a practitioner who said, hey, we're going to optimize your T4 and your T3 level. And they've brought T3 with a lot heavier levels of T3 into what they call their optimal range, but your body's telling you you feel anything but optimal. What's going on? Are they correct? Well, the practitioner, whether it's a medical practitioner or a functional medicine practitioner, regardless of what type of medication they're using, they are focused on manipulating a lab value that they're concerned about into a specific range. The medical practitioner who uses T4 only, they're focused on manipulating TSH into a range. They give you enough T4, they see TSH go into the range they care about, and then they say that you've been normalized or optimized. The functional or integrated practitioner that utilizes T3, they'll typically see that your TSH is normal with the T4 medication you were given, but your T3 is lower than is optimal. They think that's broken physiology versus adaptive physiology, so they think they can fix it or optimize it by giving you lots of T3 and raising your T3 levels into their predetermined range that they care about. They care less about TSH, they care less about T4. They're only focused on T3 potentially because they say that's the hormone that makes the difference, that's the active hormone. But both of them are potentially wrong in what they're trying to accomplish. Both of them are being fooled by the labs, the story the labs are telling them. They're believing that if they manipulate your blood level of the marker they care about into range, that they've optimized your blood level and therefore they've optimized your thyroid physiology. And it's probably not even close. If it was the case in most situations, you wouldn't probably be listening to this video. I wouldn't have people listening to the podcast. There wouldn't be surveys and research papers out there talking about how unhappy our thyroid patients are and how dissatisfied they are with their care. So what's really going on? Thyroid symptoms, keep this in mind. Thyroid symptoms are the result of too much or too little thyroid hormone inside cells and tissues. And so if you have too much T3 in the cell, that's going to trigger more hyperthyroid symptoms. If you have too little hypothyroid or too little thyroid hormone in the cell, that's going to trigger hypothyroid symptoms. And what some people don't realize is that when you're taking thyroid medication and you're under excessive stress response, what we call allostatic regulation, if you provide more thyroid hormone than the body needs, you will create hyper and hypothyroid symptoms at the same time. Okay? So what's important, if these symptoms are caused by T3, the amount of T3 inside the cell, that when we manipulate the blood values don't always represent the status of thyroid hormone inside the cells. It would be nice if it did, but it doesn't. And if you're not aware of that, then you manipulate a TSH into range and assume that you fixed somebody, despite them still looking hypothyroid. You manipulate a T3 into your predetermined optimal range, and they still have hypo and hyperthyroid symptoms many times. So thyroid hormone replacement therapy can manipulate blood values. It can change symptoms, at least temporarily, but it may optimize blood levels or normalize blood levels without optimizing the T3 state inside the cell and without optimizing your thyroid physiology. So you get a hit of thyroid hormone, you feel a little bit better, but then you don't keep improving. You kind of plateau or you start to regress, and then you take a little bit more hormone and you feel a little bit better, and then you plateau, and then you start regressing, and then you take more. And now you're on this kind of roller coaster ride of trying to find this magic dose that's going to make you feel good. So what do? Here's my kind of 3 big rules when you're looking to assess thyroid physiology. And I do not recommend that you try and figure this out on your own. It's relatively complicated. So that's my number 3 point here. You should always try and work with a functional medicine practitioner who really understands the nuances of thyroid physiology, and especially when we're prescribing medication. If you're going to see a functional medicine practitioner and they're not talking to you about your state, are you in homeostasis or allostasis? They're not talking about the stressors that are creating this allostatic regulation, and they're just trying to optimize your blood labs as if you're in homeostasis, you're in trouble, because you're not going to feel and function well, even though you're being gaslit that your labs are normal. So I guess we'll start with number 3. Work with a functional medicine practitioner who interprets labs, not just reads them for H or L. We've kind of grown up in this world. When we look at a lab report, if the value is highlighted and there's an H next to it, then that value is abnormal because it's high. If it's highlighted and there's an L next to it, that value is abnormal because it's low. And we assume that that is the problem, and we just do something to manipulate the value. The lab value is not the problem. The lab value is the response of the physiology. The lab value should tell us a story if we're trying to interpret it. If all we're trying to do is read a lab report for H or L, that's super easy, and then you just prescribe based on whether it's high or low. But that doesn't help people often heal and recover. It definitely doesn't work very well in thyroid world. So what we want to do is interpret labs. So we could have a lab value that's normal and it's appropriate. The TSH is normal, you feel good, you function good, you don't have any hypothyroid symptoms, the value is normal and it's probably appropriate. If the lab value is normal, but you're sitting across from me with thinning hair, overweight, tired, fatigued, constipated, dry skin, all the classic hypothyroid symptoms, then even though that lab value is normal, it's inappropriate for the person sitting in front of me. It's inappropriate for you. So I don't want to look at that TSH and just say, well, that's normal, so you don't have a thyroid problem. I want to look at that and say, she looks like she has a hypothyroid condition, but TSH is in the normal range. So it's this value, while it's normal, it's inappropriate for my client who's sitting in front of me. And now my job is to look at the rest of the thyroid panel, the rest of the blood chemistry, their health history, health timeline, to determine what's causing that TSH to be artificially normal, okay? And it's normal, but inappropriate for the patient. The other thing when it comes to interpretation, we can have a lab value that's abnormal. So many people who have hypothyroid signs and symptoms see an abnormal lab value and they're bummed out. They shouldn't be. They should be kind of happy. I feel like I'm hypothyroid. The labs indicate I'm hypothyroid. That's a great starting point. Now you're not going to be gaslit that you don't have a thyroid problem, even though you have all the signs and symptoms. But an abnormal value, let's say TSH or T3, isn't the problem. It's a sign of a problem. That abnormal value is telling us a story. Thyroid physiology is being downregulated for a reason. It's our job as the practitioners to help you figure out what's causing that adaptive downregulation. So we have to interpret it. The value is abnormal, but it's appropriate for my client. The other thing we sometimes might assess is that the lab value is abnormal and totally inappropriate. What does that mean? That means the person feels great, functions great, and a lab value is way out of range, and it doesn't make sense for the person sitting in front of me. Sometimes that's a bad lab value. It's an error in the testing. Other times it's a sign of more sinister things going on. The number 1, always, always, always run a comprehensive thyroid panel. TSH, total T4, total T3, free T4, free T3, T3 uptake, reverse T3, thyroid antibodies. And people will say, well, I don't need those things to assess your thyroid physiology. What that should tell you is they're just trying to manage numbers. They're not trying to restore your physiology. If to really interpret what's going on, you need all those values. And then number 2, always run a thyroid panel with at least one tissue marker of thyroid status. For me, the most common one I run is lipids, because the lipids give me a huge window into what the T3 is doing for the liver, what the T3 is doing for the adrenals and other tissues. So hope this helps a little bit. If you've been told a story that your thyroid labs are normal, but you know you don't feel that way, this is typically why. And here's some strategies that you can use to help understand what to do to correct it. Hope this helps.